I ever wondered what happens, behind the scenes when it comes to men's sexual health. It's a topic that sparks a lot of curiosity and sometimes even anxiety.
Yeah, definitely.
Welcome back to the Deep Connection podcast. Today we're going on this journey to explore the fascinating world of men's reproductive systems
Okay.
and what happens when sexual activity takes a pause.
It's definitely a topic filled with myths and misconceptions.
Yeah.
So let's break it down. Let's separate fact from fiction.
Okay, let's dive in. One of the biggest questions I hear is, what happens to all that sperm if it's not,
Yeah.
being put to its intended use? Does it just build up?
That's a common myth. Our bodies are incredibly efficient.
Okay.
Instead of endless accumulation, the body has a natural recycling system for sperm.
Okay.
Older sperm cells are broken down, and their components are cleverly reused to create fresh, new sperm.
So it's like a constantly running sperm factory, even if a man isn't sexually active.
Exactly. This process ensures a continuous supply of healthy sperm, regardless of how often a man ejaculates. Okay. It's important to remember that sperm and semen are not the same thing.
Right.
Sperm are the tiny cells that carry genetic information, while semen is the fluid that transports and nourishes them.
That makes sense. So where does all this sperm production and storage take place?
The magic happens in the testes, where sperm are produced.
Mm-hmm.
Then they move to the epididymis,
Okay.
a coiled tube where they mature and are stored until they're well needed. And speaking of sperm needing an exit strategy, we can't avoid talking about those wet dreams.
Ah, yes, the nocturnal emissions that often make an appearance during teenage years.
Exactly, but they're not limited to teenagers.
Right.
They can happen throughout a man's life, though they might become less frequent as he gets older. Essentially, it's the body's way of naturally releasing built-up sperm.
It's like a pressure valve release system for the sperm factory. Now, I know this is a question that many men are curious about,
Yeah,
even a little anxious about penis size.
right.
Does abstaining from sex cause shrinkage?
It's a question surrounded by a lot of anxiety, but the answer is a bit more nuanced than a simple yes or no.
Okay.
While long-term abstinence, we're talking decades here,
Right.
might lead to a slight decrease in size due to muscle atrophy,
Okay.
it's not something most men would likely notice.
So like any muscle in the body, if you don't use it,
Yeah,
you might lose some of its tone and size.
precisely. But remember, genetics plays a huge role in penis size. Plus, the body tends to prioritize essential functions.
Right.
So you wouldn't see dramatic changes after short periods of abstinence.
That's good to know. Now let's shift gears and talk about the hormonal symphony that plays out when sexual activity changes. We hear a lot about testosterone, the primary male sex hormone. How does it factor into all of this?
The relationship between testosterone and abstinence is complex and not entirely clear-cut. Some studies suggest that testosterone levels might actually increase with abstinence,
Interesting.
while others point to a decrease. It's a bit of a hormonal puzzle that scientists are still trying to piece together.
So it's not as straightforward as we might think.
Right.
And it's not just testosterone in the mix.
Yeah.
What about other hormones related to sexual pleasure and bonding?
You're right. Hormones like oxytocin, often called the love hormone,
Mm-hmm.
and dopamine associated with the brain's reward system are
Right.
also key players. Abstinence could potentially affect the levels of these hormones, which might lead to feelings of loneliness or isolation in some men.
That makes sense. It highlights the interconnectedness of our physical and emotional well-being.
Absolutely.
It's not just about the physical act itself, but also the emotional and psychological aspects.
Absolutely. Our bodies and minds are in constant communication, and understanding that interplay is crucial for overall well-being.
Speaking of interesting connections, let's talk about the link between ejaculation frequency and prostate health. This is a topic that often comes up with men as they get older.
It's an area of ongoing research, but studies have shown that men who ejaculate frequently, think more than 21 times a month, have a lower risk of developing certain prostate conditions like benign prostatic hyperplasia or BPH, and even prostate cancer compared to those who ejaculate less often.
BPH, can you explain that one for our listeners who might not be familiar with it?
Of course. BPH is a non-cancerous enlargement of the prostate gland, which can cause urinary problems as men age.
Got it.
So while more research is needed to confirm a direct cause and effect relationship, these findings suggest a potential protective effect of regular ejaculation on prostate health.
That's fascinating. It seems like there are so many factors that play into men's sexual health.
Yeah.
From hormones to physical activity to even how often they ejaculate.
Exactly. It's a complex and interconnected system, and we're only just beginning to understand all of the nuances.
Now, I want to address a common myth that I'm sure many people have heard. The idea that you can somehow influence the sex of your future child by abstaining from ejaculation.
Right.
Is there any truth to that?
That myth likely stems from a study that found a very slight increase, about 2%. About 2%. Okay.
In X chromosome-carrying sperm, which are associated with female offspring
Okay.
after 10 days of abstinence.
Understand.
But honestly, a 2% increase is not statistically significant enough to impact family planning decisions.
So it's basically just a fun fact rather than a reliable strategy for choosing the sex of your child.
Exactly. It's always important to rely on evidence-based information when it comes to such important decisions.
Speaking of evidence-based information, I think it's important to acknowledge that while we've been discussing potential downsides, abstinence can also have its advantages.
Absolutely. The most obvious benefit is a significant reduction in the risk of sexually transmitted infections, or STIs.
Right.
For men, abstinence can also lower the risk of urinary tract infections, or UTIs, which can sometimes be transmitted sexually.
That's a huge plus.
Yeah.
And beyond the physical benefits, wouldn't you agree that there can be emotional and psychological benefits to abstinence as well?
Absolutely. Abstinence can be a time for self-reflection and exploration.
It allows you to understand your body's responses, set personal boundaries, and focus on other aspects of your well-being, like emotional and mental health.
It's all about making choices that align with your values and what feels right for you at any given time.
Exactly. It's about taking ownership of your sexual health and making informed decisions that support your overall well-being.
Well, we've covered a lot of ground in this first part of our deep connection into men's sexual health. We've debunked some common myths, explored the complexities of hormones and sperm, and even touched on the link between ejaculation frequency and prostate health.
This is just the beginning. We have so much more to explore, including the emotional and psychological aspects of men's sexual health.
Stay tuned for part 2, where we'll delve even deeper into this fascinating topic.
Welcome back to the Deep Connection podcast. We're diving deeper into the often misunderstood world of men's sexual health, and there are some fascinating aspects we haven't even touched on yet.
It's incredible how many myths and misconceptions surround this topic. I feel like we're only just scratching the surface.
You're absolutely right. There's so much to unpack, and it's important to have open and honest conversations to address these sensitive topics.
One topic that often generates a lot of questions and even some anxiety is vasectomy.
Right.
I know many men are curious about the procedure itself and its long-term effects. Can you shed some light on this?
Of course. A vasectomy is a surgical procedure that prevents sperm from being released during ejaculation. It's considered a permanent form of contraception.
So it's essentially a way to permanently turn off the sperm pipeline.
That's a great way to put it. During the procedure, the vasectus deferens, the tubes that carry sperm from the testes to the urethra, are cut and sealed, preventing sperm from mixing with semen.
That makes sense.
Yeah.
But if sperm is still being produced, where does it go after a vasectomy? Does it just build up in the body?
Remember that incredible recycling system we talked about earlier?
Right.
It becomes even more crucial after a vasectomy. The body continues to produce sperm, but since it can no longer travel through the vas efferens, it's broken down and reabsorbed by the body. It's a remarkably efficient process.
That's reassuring to know. It seems like our bodies have a way of handling things even when we make changes to the system. Now, I know a lot of men wonder how a vasectomy impacts sexual function. Does it affect a man's ability to get an erection or experience pleasure?
That's a common concern, but it's important to understand that a vasectomy doesn't interfere with the physical mechanisms of arousal or orgasm.
Okay.
Men will still experience erections and ejaculate, but the semen simply won't contain sperm. The sensation and pleasure remain the same.
So it's like enjoying your favorite beverage, but without the added ingredient that you no longer need.
Exactly. You still get all the enjoyment and satisfaction, but with a different outcome.
I like that analogy. It makes it much easier to understand. Now let's shift gears back to hormones for a moment. Earlier we talked about testosterone, but there's another hormone that's often mentioned in the context of sexual health. Dopamine.
Okay.
Can you explain what role dopamine plays in our sexual experiences?
Dopamine is often called the feel-good hormone, and it's a key player in the brain's reward system. When we engage in pleasurable activities like sex, our brains release dopamine, which reinforces those behaviors and makes us want to repeat them.
Got it.
It creates a positive feedback loop, driving us towards things that make us feel good.
So it's like our brain's way of saying, this feels good, let's do it again.
Exactly. And this applies to all sorts of enjoyable activities, from eating delicious food to listening to our favorite music to spending time with loved ones. Dopamine plays a role in all sorts of rewarding experiences, including sex.
But what happens to dopamine levels when a man abstains from sex? Does that mean his dopamine levels plummet, leaving him feeling down?
It's not quite that simple. While some individuals might experience a decrease in dopamine levels, leading to feelings of restlessness or low mood, it's essential to remember that dopamine is involved in many aspects of our lives, not just sex. Engaging in other activities you enjoy, hobbies, exercise, social interactions can help boost dopamine levels and maintain a sense of well-being.
So it's all about finding healthy and fulfilling ways to stimulate those reward pathways in our brains, regardless of our sexual activity.
Absolutely. It's about finding that balance and engaging in activities that bring us joy and satisfaction. Now, shifting gears a bit, I think it's essential to address another important aspect of men's sexual health, erectile dysfunction, or ED.
It's definitely a sensitive topic,
Yeah,
but I agree that it's important to talk about it openly and honestly.
absolutely. ED is more common than many people realize, and it can affect men of all ages. It's the inability to achieve or maintain an erection firm enough for sexual intercourse, and it can be a source of stress and anxiety.
I imagine it can be a very isolating experience for men who feel like they can't talk about it. What causes ED? Is it purely a physical issue?
The causes of ED can be complex and multifaceted, ranging from physical factors like heart disease, diabetes, hormonal imbalances,
Wow.
to psychological factors like stress, anxiety, and relationship problems.
Right.
It's often a combination of factors, and it's important to seek medical advice to determine the underlying cause.
So it's not just a plumbing issue, as some might think. It's often a sign of deeper underlying issues that need to be addressed.
Exactly. It's important to remember that our physical and mental health are interconnected. Addressing any underlying health concerns and seeking professional help can make a world of difference in managing ED.
It's encouraging to know that men don't have to suffer in silence. There are treatments and support available.
Absolutely. There are effective treatments for ED, from lifestyle changes and medication to therapy and even surgery. It's about finding the best approach for each individual's needs.
Now, I want to circle back to a topic we touched on earlier,
Mm.
prostate health.
Um,
We discussed the potential benefits of frequent ejaculation in reducing the risk of certain prostate conditions.
Right.
But are there other things men can do to proactively maintain their prostate health?
That's a great question. It's always better to be proactive when it comes to health, and prostate health is no exception. Maintaining a healthy weight, eating a balanced diet, rich in fruits, vegetables, and whole grains, and getting regular exercise are all crucial for overall health, including prostate health.
So it's about adopting a holistic approach to well-being and making healthy choices that benefit the entire body.
Exactly. And it's never too early to start making those healthy choices. It's an investment in your long-term health and well-being.
I feel like we've covered a lot of ground in this second part of our deep connection into men's sexual health. We've discussed everything from vasectomy to dopamine's role in pleasure to the importance of addressing erectile dysfunction and proactively taking care of prostate health. What else is there to explore in this fascinating world?
We've delved into the physical and biological aspects, but there is a whole other layer we need to unravel: the emotional and psychological dimensions of men's sexual health.
I'm intrigued.
Yeah.
Let's dive into that in the final part of our discussion. Welcome back to the Deep Connection podcast. We've been on quite a journey exploring the ins and outs of men's sexual health, covering everything from sperm and hormones
Right.
to vasectomies and prostate health.
We've delved into the biological mechanics, but
Yeah.
now it's time to shift gears and explore the often overlooked emotional and psychological dimensions. This is where things get really interesting.
I'm all ears. It's easy to get caught up in the physical aspects,
Yeah,
but I know the mental and emotional side of things plays a huge role in overall sexual well-being.
absolutely. And one of the biggest topics in this realm is libido, or sex drive. It's something that can fluctuate throughout a man's life, and understanding those shifts is crucial.
I think a lot of men worry when they notice changes in their libido, wondering if it's a sign of something being wrong.
Right,
What factors actually influence a man's sex drive,
right.
and is it normal for it to change over time?
Libido is a complex interplay of biological, psychological, and social factors. Hormones, especially testosterone, definitely play a role.
Okay.
But so do things like stress levels, relationship dynamics, self-esteem, body image, and even cultural norms.
So it's not just about our physical wiring. Our thoughts, feelings, and experiences all contribute to how we experience and express our sexuality.
Precisely. And just like our lives are constantly evolving, so too can our libido.
Okay.
It's perfectly normal for a man's sex drive to ebb and flow over time,
Right.
influenced by factors like age, relationship status, work pressures, overall health medications, and even sleep patterns.
That's reassuring to know that fluctuations are natural and don't always signal a problem.
Yeah.
But what if a man is experiencing a significant and persistent change in his libido
Yeah.
that's causing him distress? What should he do?
That's a great question. If a man is concerned about changes in his libido, talking to a healthcare provider or a therapist is a great first step.
Okay.
They can help explore potential underlying causes and discuss strategies for addressing them. Sometimes, simple lifestyle changes or addressing underlying medical conditions can make a big difference.
It sounds like open communication and seeking support are key.
Yeah.
And speaking of communication, I think another area that often gets brushed under the rug is performance anxiety.
Right.
It's something I imagine many men struggle with,
Mm-hmm.
but it's not talked about enough.
You're absolutely right. Performance anxiety is a common experience that can affect both men and women. It often stems from the pressure to perform sexually, leading to feelings of self-doubt, worry, and fear of failure.
It's like having stage fright,
Yeah,
but in the most intimate of settings.
exactly. And just like stage fright, performance anxiety can create a vicious cycle. The more you worry about not being able to perform, the more likely it is that you'll actually experience difficulties.
So how can men break free from this cycle of anxiety and self-doubt?
Communication is crucial. Talking openly with your partner about your feelings and concerns can help alleviate pressure and create a more understanding and supportive environment. It's also important to challenge those negative thoughts and expectations. Instead of focusing on the performance, try to shift your attention to the pleasure, connection, and intimacy you're sharing.
It's about reframing the experience and focusing on the positive aspects, rather than getting caught up in the fear of failure.
Exactly. And if performance anxiety is causing significant distress, seeking professional help from a therapist can provide valuable tools and strategies for managing it. There are effective techniques that can help men overcome these challenges and enjoy a more fulfilling sexual experience.
I think it's so important to emphasize that asking for help is a sign of strength, not weakness.
Right.
We all need support from time to time, especially when it comes to such personal and often sensitive issues.
I completely agree. Taking care of your mental and emotional health is just as important as taking care of your physical health. They're all interconnected, and supporting one supports the others.
Well, it feels like we've come full circle in our exploration of men's sexual health. We started with the biological basics, delved into the intricacies of hormones and prostate health, and now we've landed on the crucial importance of the emotional and psychological landscape.
It's been a fascinating journey, and I hope our listeners have gained a deeper understanding of the multifaceted nature of men's sexual health.
I think the key takeaway is that there's no shame in talking about these topics openly and honestly.
Right.
Whether it's with your partner, a healthcare provider, or a trusted friend. Communication and support are essential for navigating the complexities of sexual health.
Absolutely. Remember, you're not alone in this journey. There are resources available, and seeking help when you need it is a sign of strength and self-care.
And on that note, we've reached the end of our deep connection into the world of men's sexual health. I hope this conversation has been insightful and empowering. Remember, everyone's journey is unique, and there's no one-size-fits-all approach.
If you're looking for more information or support, don't hesitate to reach out to a healthcare professional or explore the many reputable resources available online and in your community.
And if you found this exploration of men's sexual health interesting, subscribe for more thought-provoking discussions on the Deep Connection podcast. We'll be back soon with another deep connection into a fascinating topic.